I'm Giovanni Martinelli, I'm the Scientific Director of Istituto Romagnolo per la cura dei tumori di Amadori. My institution was involved in the so-called rete or networking of IRCCS, the institution that in Italy is supported by the Minister of Health on getting more translational of the novelty and the new things directly on the bed of the patient. So we are involved as might be possible to translate immediately in cure what the patients need and coming from the research. In this project we get a very important role, or we hope to get an important role, which is related to the fact that we are disseminating the results of this important project, which means not just to publicate or to get a publication of the results, but is to involve the European community, and let me say also the European population, in this very important program, which is associated with the dissemination of a new entity, which is the capacity to be part of sharing big data together without protecting the privacy of the individual citizen. This is a very ambitious program, and in this ambitious program we get the capacity, we hope to get the capacity to be part in the dissemination of this important, very important project. Our institution will be provided two examples of these cancer patients. The patient affected by lung cancer and the patient affected from head and neck cancer. Just a model of the cancer that can be treated in this moment without artificial intelligence machinery and without capacity to include big data in the clinical decision, but in the future. And using these approaches, we will be able to get a capacity to better choose the drugs, the therapy, the path of cure of our patient. Any patient has a history, any patient has an individual, totally personalized history with cancer or with other disease. And we would like to integrate each contribution of these patients to the history of how we fight cancer. We can get a lot of information if each individual patient affected by cancer will be part of this process, which make possible to make better decision, better pathway, and better stratification of the therapy in the future. So it's not just an individual disease, it's a disease that became popular, unfortunately popular, in Europe and the world, but each contribution will be very important to fight the cancer. In the 2025, we expect, but we expected before, we expected to get the capacity to recognize how we can protect the data of our patients which are in a single institution treated with anti-cancer therapy, but more relevant, to put together the data, to analyze the data together, to get immediately new stratified population of treatment, new stratified population of better treatment, and let me say also better drugs and better opportunity to be cured, which is the real aim of our project.